I'd like to pay tribute this morning to the work done by the Ministry of Health, led so ably by the Minister, and to thank the representatives of your ministry who are here today, who represent all of those who've been on the front line since Fiji has been battling COVID-19 since it first arrived on Fijian shores. The persistent and dedicated work of the health personnel in Fiji have managed to keep us all safe, and I'd like to pay tribute to the response of the Fiji government, the way that they have moved so quickly and so decisively to deal with this problem. And that's why well past 2 incubation cycles now, we've had no more infections, and Fiji will very shortly be able to declare itself COVID-free, and that is a wonderful achievement. And so I'd like to really pay tribute to all of those who contributed to that. It's been a whole of government effort, but led by the Health Ministry. As you know, Australia has and will continue to support the Ministry in their efforts to combat COVID-19. But what I'd like to say this morning is that it's really fantastic to see local solutions emerging which are both effective and innovative. And in that respect, I'd like to thank MDF, but especially Skyward Industries, who are working together to make this possible, the first of its kind in Fiji and in the Pacific. And Skyward and MDF need a big pat on the back as well.
COVID-19 has inspired a lot of my team and also the people that we work with around us to really rethink what we do, but also rethink about the equipment and the capabilities that we have. And we were fortunate enough to start working with the lovely people at MDF and also the Ministry of Health to be able to look towards finding some self-sustainability in Fiji to develop some critical items to combat the COVID-19. Now, it has not been easy for all of us, of course, but we really believe that a small stride forward in the right direction, such as what we're doing today, is really a bit of a symbol and a showcase to the rest of Fiji and perhaps the world that that when we, in the face of crisis, that we can change and that we can have and find in ourselves the ability to really come together, think outside the box, and to really be able to innovate towards a better future together. So
Australia is indeed a vuvale and a big brother, and a place where Fiji looks towards, not only in times of crisis, but even in normal times. And nevertheless, Australia has always been there to support us, even in the midst of whatever we go through. And in the midst of its crisis, this is indeed a pandemic, and every country in the world is facing it, including Australia. The fact that they continue to support us shows the extent of the relationship that we have, and that we are indeed vuvale, indeed family. So, Nawalevu, Australia, and thank you, Your Excellency. To our friends from Skyward Industries, Mr. Kevin Rossett and your team, I'd like to thank you very much for looking at the opportunity which this COVID-19 has brought forward. One thing that's very clear in medicine is some of the most significant advances in medicine happens during crisis. So happened through World War I, World War II. In World War I, some of the Australasian doctors went across to Europe to train. And one of them that's quite famous now is called the late Dr. Gillies, or Mr. Gillies. And these are people that went across and realized that there were opportunities in the midst of a crisis to be able to learn, to be able to innovate. And all the major crises that have affected the world medically, whether it be through wars or through pandemics, Fiji has never had an opportunity to be at the forefront of this. And this is a 101 global pandemic in which Fiji is very well placed to be part of that innovation, to be part of that creation. And I'm thankful for the opportunity that Skyward Industries has taken on itself with the support of Market Development Facility. And thank you, Australian Government, for supporting them and inadvertently and directly supporting Skyward Industries in being able to come up with this innovation. That will be very helpful to the work that we are going to do. In Parliament yesterday, I responded to a motion before Parliament in which a few of us were thanked, and I stood up and I said, I want to thank all the 6,000 staff within the Ministry of Health, because this is not a one-man show or three-man show or five-man show. It's a 6,000 women and men holding hands and working together. Everyone plays a very important role in this major public health initiative, and as I've said earlier, a 101 or 1 in 100 years pandemic that we are facing. There is a new normal, and a new normal we have to accept. The new normal means that there will be better sanitization, that there will be better sterilization, that there will be better infection control, and we have our infection control nurses here with us, and we have to accept that this is the new normal. It also means that the way that we provide our health services and the role of our health services in this country has to evolve. We have to pivot accordingly. And as Dr. Takeshi Kasai, the Regional Director of WHO, has said, we have to be agile in what we face and what we do. So we accept that this is a new norm. And there are opportunities in this new normal for industries such as Skyward, and for opportunities for Market Development Facility to support industries, growing industries such as Skyward Industries, to be able to support the work of the new normal. Because we have to accept that COVID-19 will not go away tomorrow. It is something that we have to deal with in every part of industries, whether it be government-based industries or in the private sector. We'll have to accept that this is the new normal. I would like to finish by saying that the fight is not over. In any way, if we think about it, the fight has just truly begun. And whilst we may think that we have only three active cases left, we must realize, as the Honourable Prime Minister and the Honourable Attorney General Minister of Economy said, we cannot allow a second or third phase wave to come. And all of us collectively have a role to play. And if we look at what's happened around the world, some of the nations around the world were able to handle the first wave of this COVID-19, but were brought to their knees with the second or third wave of COVID-19. In Fiji, we have set ourselves an impossible goal. The impossible goal is no one will die, and we will not get a second wave. And together, we can. Thank you.
Okay, thank you, Honourable Minister. Just before we proceed on with the photo session,